your noise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Weren't sure you wanted to sit down yet? Oh. Yes, I am on. Good morning, everyone. Good to see you all. Melanie, this is Chris Christensen. He's sitting in for Josh Chamberlain in case you haven't had the pleasure. Yeah. Okay.
Thank you.
I got it now, Holly. Took me a minute. Thank you. Okay, roll call, please.
Commissioner Mapes. Commissioner Christensen.
Here.
Commissioner Turnbull.
Present.
Commissioner Aaron's. Commissioner Van Alstine. Commissioner Mason. Commissioner LeVanway. Here. Commissioner Hankins.
Here. Okay. We take a motion to approve the agenda.
Second.
Moved and seconded. Any further discussion? Just as a friendly reminder, I would ask you all to make sure your mic is up close enough so that everyone can hear on Zoom. Yeah, make sure you're turned on there. Are you on, Hank? Okay. We had a motion and a second to approve the agenda. You have a roll call, please.
Commissioner Turnbull.
Yes.
Commissioner Hankins.
Yes.
Commissioner LeVanway. Yes. Commissioner Mason. Commissioner Aaron's.
Yes.
Commissioner Christensen.
Yes.
Commissioner Van Alstine.
Yes.
Commissioner Mapes.
Yes.
Motion passed.
All right. Review and approval of the meeting minutes from August 6th, 2024.
I'll make a motion that we approve the minutes.
A second.
Moved and seconded. Any further discussion? Hearing none, can we have a roll call there, please?
Commissioner LeVanway.
Yes.
Commissioner Christensen.
Actually, I'm not going to vote on the minutes. I wasn't present at the meeting. Thank you.
It's a snapshot in time.
Okay. Well, then I approve what was written.
Thank you. Commissioner Aaron's.
Yes.
Commissioner Mapes. I'm sorry, Commissioner Mapes.
Yes.
Commissioner Turnbull.
Yes.
Commissioner Hankins.
Yes.
Commissioner Van Alstine.
Yes.
Commissioner Mason. Thanks.
All right, ladies and gentlemen, that moves us to public comment. If you'd like to address the Board of Health, we'd ask you to step to the podium, state your name and where you reside. You'll have 3 minutes to address the board. I'll give you a friendly reminder with 30 seconds left. Good morning, Mary.
Morning, Mary Lieberman, Emmett County. My understanding is that today you'll be discussing the budget, and I hope that during that budget discussion, there will be some mention about the status of each county's payment of their appropriations. I'd like to know if they're up to date, and if not, what the game plan is going forward to get them up to date. Thank you.
Would anyone else like to address the Board of Health? Okay, hearing none, we will close public comment. That moves us to staff reports. Mr. Thorell.
Good morning. I have a short presentation that Nate, our IT specialist, is going to pull up on the screen there. So basically just a few slides here, but talking about public health finance and a look at local appropriations and how they fit into the big picture. So next slide, please, Nate. So just pulling up the, or looking in your packet too, but also on the screen, just the pie chart of our fiscal year 23 sources of revenue. As you can see, our local appropriations was a small sliver of the pie, but it's in there at 1.127 million. And as compared to some of the other sources, you can see how it compares to some of our other sources of revenue. So just to talk a little bit about local appropriations, we use that to support multiple agency programs, including our essential local public health services, which are the mandated state services. And also we use local appropriations when cost sharing is required by a program. And then also we use local appropriations when matching is available to leverage local dollars to maximize funding through for the community. So talking about, how we do that, as a local health department, we can utilize unique funding mechanisms such as Medicaid outreach and Medicaid cost-based reimbursement due to the population that we serve. We actually every year develop a memo, a Medicaid outreach memo that kind of comes up with formulas based on the Medicaid population that is in our jurisdiction. We provide these services for, the folks that are not able to access care from private providers or need additional support not offered by providers. And just going on to the next slide, Nate, just a really quick looking at the small spreadsheet about how this works and how much funding comes to the health department using local dollars. So as you can see, there's three items on the left: Medicaid outreach, children's special health care services, Medicaid outreach, and then Medicaid cost-based reimbursement. And those, the Medicaid outreach line item, the local amount eligible for match is 449,000 approximately, or approximately 100 or 450,000, I should say. Children's special health care is approximately 16,000, and then Medicaid cost-based reimbursement is approximately 400,000. And what the Medicaid cost-based reimbursement is, what that is it's the difference between what Medicaid pays versus what private insurance pays. And it's the difference between those two, and we're able to recover that. So in total, if we're looking at all of those, we had 864,000 that was eligible for match. And so we were able to get 1.6 million based on that 864,000. So it's really a ratio of about for every $1 of local amount, we were getting 2.85 back, which is really a good deal for the community as far as leveraging those dollars. And it's about 77% of local appropriations that are actually matched. Going on to the next slide, I just want to give you kind of an idea of how do we compare with other health departments regarding our percent of budget for local appropriation. So these are district health departments. I didn't use single county health departments because they tend to, we're more similar to district health departments. So if you can see us highlighted about 3/4 down the page, for our fiscal year 23 budget, we were at about 5.9% of that budget is local appropriations. And if you look at other health departments, Barry Eaton District Health Department downstate, their local appropriations percentage was about 24%. We had another, higher one, Dickinson Iron District, although that was from fiscal year 2019, was around 20%. And then we have, a couple that are just a little bit higher than us. Benzie-Leonoz at about 9.4, Central Michigan 8.1, and Delta Menominee up in the UP is 9.35. We are basically the second from the last in this comparison of health departments from the lowest percentage of local appropriations as far as budget goes. The lowest one is Luce Mackinac Elder Schoolcraft District Health Department. They're at about 4.5. So it just kind of gives you an idea of where we're at compared to others. So really, when we're talking about the value of exceptional public health services in Northwest Michigan, one of the reasons we have a low percentage of our total budget as local appropriations is we're able to keep local appropriations low by seeking grants, having innovative partnerships and billing. We do bill. Some health departments, believe it or not, do not do that. But a long time ago, there was an investment in getting up and running with billing, and that's a huge part of it. And just a really rough calculation in fiscal year 23, the per capita investment from local appropriations was $10.37 per resident. And it helped produce $175.84 in health department services. Now, this is, includes overhead and all that kind of stuff. I mean, very rough calculation, but I think it just in general shows, it's a really good deal for the community. And if you, look at what you get out of what is invested. Multiple studies have shown when people are connected with services that prevent adverse health outcomes, public health programs, overall cost of healthcare in the community is significantly reduced. Local dollars used in matching programs help support pregnancies, children, moms, and families during a critical time in development. In addition, local dollars support our other programs like immunizations, school health, environmental health, and many other programs that I'm not listing all of them here. But and really, to finish up, physical and mental health of the community is linked to the economic health of the community as well. One good example that I've used is that, we have, in many ways, a tourist economy around here where we have a lot of workers, working in those industries that kind of keep that afloat. And many of those folks are our clients as well. So if you think about that, helping them stay healthy keeps them working and keeps our economy going in some respect, but in many other ways too. But that's just one example. And that's all I have on that. If anybody has any questions, I do have another quick update. But if anybody has any questions
Mr.
about this
Christensen, go ahead.
presentation.
So it's been a while since I've been to a health department meeting, but just to clarify, so you collect $1.1 million from the 4 counties, and then you allocate 864,000 of that to be matched. And that's good. I mean, that's not a criticism. I'm clarifying, but once that 864 is allocated, is it allocated to those programs for that match? You're not able to double allocate funds in that capacity, right? I mean, those funds have to be dedicated to whatever it is they're matching.
Right. And it's in the course of operating our programs,
Mhm.
right? So it's not, it's part of just operating our programs where we just basically look at what qualifies for Medicaid outreach, what qualifies for the cost-based reimbursement.
Right. So so that leaves $300,000 remaining from the amount of funds that are being allocated from the counties. Are there other matching funds available, or have you maxed out? This is what's available to match based on the funds that we've been provided with.
I think we're pretty well maxed out. I think we do a really good job of determining, what can be matched. I can tell you other health departments are, sometimes more like, for every dollar they're getting 2 or less. So I think our team does a really good job. Yeah, getting that ratio up. So, yeah.
Does anyone else have any questions for Dan regarding this presentation? Okay, go ahead, Dan.
Yeah. Just really quick. I just wanted to give a quick update regarding our Ironman Health Center in Mansalona. So, as an effort from the health department standpoint of looking at our services and, where we need to meet people to take care of their needs, we decided to basically close Ironman Health Center and then move that into a different type of program called a school wellness program. And basically, that the Ironman Health Center was more like a clinic that was outside the school building next door, but that's been, over the years has been problematic, especially for like high school kids and letting them leave the campus to come to our clinic there. We've struggled with meeting the numbers that we need to meet. That coupled with enrollment at Mansalona Public Schools has been going down over time. So working with the state, and we have these SWP school wellness programs in other schools throughout our district, thought it would be a better model to fit what they have going on there. It puts a nurse and a mental health provider inside the school, which we think will be better utilized. It's a little bit different where we don't have at Ironman, we had a nurse practitioner which, like I said, had that clinical model where they could diagnose and treat illnesses, prescribe medication, things of that nature, do sports physicals and things of that nature as well. But it just really, when we were looking at the numbers, it just didn't make sense to keep going in that direction. Jen Vollmer she's our school health director. She has been very involved in this transition, which started, a few months ago, and actually started way before then, looking at different options and how long we wanted to really keep this going. But from a fiscal responsibility standpoint, it didn't make sense to continue to try to keep this afloat. We needed to shift into a different direction. So everything else at our Family Resource Center there in Mansalona, our other health department services are not impacted. We still have immunizations, WIC, home nursing visits, reproductive health, dental clinics north is still operational there. And actually we're kind of hurting for space. A couple of years ago, I don't know if you remember those that were on the board, we were actually considering putting an addition on that building back then, and did not end up doing that. And one of the reasons is that we kind of took a different look and thought about well, if we move our school-based health services inside one of the schools, that would free up some space there, which it has. So that takes care of that issue too. But just wanted to give you an update. Our Ironman Health Center its last day is September 30th. So beginning October 1st, we'll be totally switched over to that SWP model. We are hiring for that position, hiring for a nurse. Our mental health provider that was at Ironman is just moving over to the school in that model. So am I missing anything, Jen? Okay. All right. Yes.
There was and they're gonna have telehealth there, correct?
Right. Right. So we're still looking at working with the funder we had a telehealth grant and working with them to try to figure out, what our next steps is with that telehealth option. So I'm not sure exactly how that's going to play out, but that's something that we have to take care of. Does anybody have any questions?
You mentioned from a fiscal standpoint, it didn't make sense. Is there some savings that we're going to see as a result of this?
Well, maybe a little bit. I mean, the state was, I think they were willing to, if we were continuing to try to increase our numbers, they were willing to, continue funding us in that capacity. But looking at the big picture, even though we were getting state funds to do this, it didn't make sense, just from that overall fiscal responsibility to continue doing something that we just knew we had tried, right? We've been trying for several years to make it better, to increase numbers there. And the model just wasn't fitting, and because we're switching over to a different model, we likely are not going to see a huge amount of cost savings. It was more just about how can we more responsibly use the funds that we're getting from the state and be as impactful as we possibly can.
Okay. Anybody else have any questions for Dan? Or any questions for any of our other directors based on their written reports?
Jeremy, is there any update on the state? Yes.
Yeah, actually, they did a draft, they actually did draft 7. Kind of leading. There's more towards whether or not the property has a permanent in that. That's going to be more trigger. Have that. Still in draft. And recently on something.
Yeah, actually last Thursday, there was a meeting with, we have a small group with the executive director from MELP and another health officer and a couple environmental health directors. around the state. I'm on that stakeholders group. And we were meeting with the staff from Representative Singh and Senator Singh, sorry, and Representative Skaggs, and some of their aides. Basically talking about draft 7. They had put in a statewide point of sale into it, also coupled with a risk based assessment where if you had a system that was over 20 years old and it did not have a record and it was within 300 feet of water, that you had to have an inspection. Which, the way that was moving, it was looking better. And then the point of sale after either one of those, either the risk base or the point of sale after that, then it would kick into a frequency based evaluation after 8 years. And so conceivably somebody, based on the way they had it set up in that draft, if you didn't sell your house, if you were, had a system, even if it was more than 20 years old, if you had a record on it and you weren't, within 300 feet of water, I mean, you may never even have to have an evaluation, during your lifetime. However, we found out during this meeting that there's going to be another draft coming out, and the Michigan Realtors Association was really pushing back on this, point of sale being in this draft 7. So I think they're backing away from that, which is unfortunate because, I think I've told you before, I think that's the way to go, if you're doing an evaluation program. I like the risk-based component too, because you're catching those systems out there that have no records. Who knows what's in the ground? Who knows what's happening, especially if you're near a river, stream, lake. There is some timeline built into this, which I think they are keeping, which I don't, gives the state Eagle 3 years to promulgate rules. And then you didn't even have to begin doing the evaluations for like 5 years. So it was kind of giving time to ramp up because of all the issues that were pointed out about workforce and, funding and records, because, you can't go to a health department, any health department, and say, tell me all the systems that are over 20 years old. Well, you'd have to basically go through every file and hand count, because nobody has a system that works like that, right? That you can do those kind of queries. So anyways, that's the long and short of it. We're giving comments based on the current drafts.
What kind of response did they have regarding the workforce costs that they were putting on the health departments?
Well, that was brought up too, as far as there needed to be some appropriations, tied to the bill, that, they're going to fund the requirements that the health departments that are incurred on the health departments to make sure that we have the ability to, implement what they're saying. And they're telling us that they're doing that, but, I don't know exactly how that works from that standpoint, how that gets tied to into a bill.
Well,
But we
funding
were
is
just-
one thing, but qualified personnel is. a
Oh, yeah,
separate
that's
issue.
continuously brought up. Yeah. And their solution to that is basically, that 8 years to kind of figure those things out, to ramp up, so to speak. So I don't know. Go ahead.
In a situation where there's no files, as a realtor, we run into this quite frequently. So
Right.
how does the luck of the draw happen there? I mean, if you just start out and randomly choose who needs to have a permit test or who needs to have one done, and if they can't produce the paperwork, then they're going to have to reapply.
That's a good question about how that's going to work. One of the things that's in the bills is that the state sets up a database, a program basically for the records, but it doesn't really address like the existing records and like how we're going to determine, who qualifies for what, right? Because if you have that risk-based thing in there, like I said, 20 years or within 300 feet of water, well, there's the only way to do that is you got to have a person or people going through the records looking at a map, mapping it out, right? Using GIS probably to some extent. And coming up, I think you'd have to do it like township by township and just kind of start out small and go from there, but it's going to take a lot of work. It's going to be a huge, heavy lift. I mean, once it's, if we had all that, if we had that's kind of been our point too, is we need funding to do that, where we could hire people to basically just organize the records. So, I mean, I think down the road, if that does happen, I mean, it'll be good for everybody, including realtors and all that, with to have our records, properly organized. But what this ends up being for the what the statewide code bills, if they go this fall, we don't exactly know what they're going to look like at this point.
Are we looking for a solution statewide here that doesn't necessarily exist statewide?
Well, I think, I mean, we're,
I'm just
We're-
asking your opinion.
right. So I really think, and, a lot of my colleagues think this way too, is that going about it through property transfers, right, point of sale, seem like the way to go, because people are coming, to the table with an expectation that there's going to be inspections, things are going to be looked at. There's money on the table to take care of issues, and Chris, correct me if I'm wrong, but I mean, that seems to be happening a lot anyways, right? What we point out as a problem is if you just blanket, like, you have to have an evaluation, we're knocking on your door, you need to do this, just compliance, right? I mean, how many people are going to say, go, take a hike, right? And, a question that we consistently bring up is, have the local prosecutors been pulled in to talk about this, right? Like, here, this would be a new law that would operate statewide. Have they, are they even aware that it's going on? And that they potentially would have to, enforce this down the road. I mean, right now, I mean, I hear from being at county meetings and paying attention, a lot of our prosecutors are saying they can't even get assistant prosecutors. So I'm kind of thinking that they're, it's going to be low on the priority list as far as that goes.
As I understand it, we don't even have the capacity for the septage that would be produced.
Well,
So the infrastructure for supporting all of this hasn't, this law hasn't been really addressed.
correct. And that's some of the things that are supposed to be addressed by the state, by Eagle. And as part of this, like, having a lot of time built up until this really goes into effect. So, whether that just continues, I mean, that has to be done, right? So we have to make sure that that gets done, and how how does the bill, or how would that law ensure that? That's like a big thing that we, keep on consistently bring up, right? It's one thing to pass a law to say you're doing this, but, like, how is it going to happen? How is it going to be implemented?
You got to deal with your S.
Right. Right.
Okay. Does anybody else have any questions for Dan or for any of our directors? All right, we're going to move on then to committee reports. Ms. Levanway.
Okay, in July, we approved of the bills and we passed them on to this board. So I'll make a motion that the finance committee met to review the bills and employee expenses, and would like to make a motion for the full board to approve of the July 2024 bills in the amount of $638,955.83, and the June employee expenses of $31,454.82.
Second.
Moved and seconded. Any further discussion? Hearing none, can we have a roll call, please, Mel?
Commissioner Mason, Commissioner Christensen,
Yes.
Commissioner Levanwhite,
Yes.
Commissioner Mapes,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Hankins,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Aaron's.
Yes.
Motion passed.
And then we move to our friend Ms. Klanowski.
Good morning.
Good morning.
Morning.
We are going to talk about the 25 budget. In your packet, you will find a written one-page memorandum. I'm going to walk through that. So if you want to turn the page and go to, there's some very colorful pages after that, columns. We are breaking down our finances by division. The second page of the colorful columns that has 3 blue columns in a row is really where we need to focus for the time being. That first blue column is the fiscal year 25 initial budget, which is what we need to approve today. The fiscal year 24 revised budget is the second column, and that's really just for a comparison, so you can see kind of where we came from. And the final column is the difference between those two. So if you want to kind of watch that, I'm going to kind of talk through some of the major changes that we're seeing. First off, our 25 initial budget is $37,955,859. It has increased $441,615 or 1.2% from the 24 revised budget. Generally speaking, this is a very minimal increase. I would consider this a pretty flat budget in my book. The budget being presented is a balanced budget, which is a little tricky right now because we're seeing lots of inflation and costs going up, but we worked really hard to keep it as flat as possible. And it's also based on current known funding, anticipated funding. Not all funding is completely squared away at this point in the year, so this is to the best of our knowledge. I'm going to talk about the expenses for a minute. Salaries and fringes, about halfway down the page. We worked really hard last year to make sure that every employee was accounted for in our budget correctly. This year, we took it a step further and we tightened it up even more. And instead of just taking everybody's current salaries and moving it forward to the next budget, we actually went out and calculated. We had a 3% budget or a 3% salary increase that was approved by the board at a couple meetings ago. So we took that into account. And then we also took into account any step increases that people would be receiving this year. So we feel like our salary and fringe is pretty tight. It's getting much better than we've done in the past. We're really proud of that. Our salaries have increased in total about 1.1 million compared to last year's budget. And again, that is due to the 3% increase that was awarded to the staff by the Board of Health and fully staffing some of our vacant positions. Our school health section has had some vacancies for quite a while, and they are getting those filled and squared away. The fringe benefit line has gone down significantly. You're going to see that it decreased 1.37 million. And this is due to the dental spa settlement that we received in fiscal year 24. If you remember, that was 1.6 million that we recognized. And part of that was to cover the rising costs of medical insurance claims. And then we also made a payment toward our pension liability. So in 24's budget, that hit the fringe benefits line. You see it coming back out in the 25 budget. That's the significant decrease. Supplies and materials have increased. We're doing more services. So when we do more services, especially in our dental section, you see the supplies increase. And then space and communication costs increase as we fill vacant positions. We see those increase a little bit as well. I want to talk about revenues for a moment. The fees and collections have increased. That's the first line in revenues, mostly due to the Medicaid funding and filling some of our school-based staffed positions. That Medicaid funding went into effect not this January, but the January before, January 2023. We are still trying to figure out what normal is under these new reimbursements. So it's good for us, but we're still trying to balance that out and find that normal, so to speak. We are also seeing in the state funding line, that second line, you're going to see the 1.6 million in dental spa that we recognized in 24 coming back out of that line. So that accounts for that significant decrease. Local appropriations, we're holding flat once again. And then some of the state funding from MDHHS has increased for technology and infrastructure funding in our school health division. Yes, sir.
You want to take questions along the way, or you want the questions to wait till the end?
I am at the end, so I will entertain any questions.
Okay. So, been a lot of discussion, both from the public and from Mr. Thurell so far regarding local appropriations. Let's talk about the elephant in the room. Where are we at between the four counties as far as local appropriations, and you can
Well-
enlighten us.
I would be happy to. So in the budget, in regard to the budget, we are keeping it flat and we're asking for the same 1.13 million that we've always asked. Now, what we ask for and what is approved can be two different things. Currently, and I'll give you 2024's numbers. Charlevoix County, we asked for 272,961. We were given 272,961. Antrim County, we asked for 245,480. We were given 245,480. Emmett, we asked for $357,382. We were given the $357,382. Otsego County, we asked for $262,872 and we were given $255,000. So it was a shortage of $7,872. Our estimates and what we ask for are based on the census data and the population. So our calculation is completely based on population in each of the four counties and then dispersed according to those percentages.
What was the shortage from Otsego?
$7,872 in fiscal year 24.
$7,872. Okay. And how long has that been the case?
I can go all the way back to 2013. It has been shorted all the way back with the exception of 1 year. And that was, I tend to skip lines, 2021. We were paid in full.
Okay.
How do you make up that?
So we, on our environmental health fees, where we have permits and licenses, we add a surcharge onto the licenses and permits for that county. We recalculate it every year just to be sure that we are accurate and that we're not getting significantly more, significantly less. We are currently charging $15 on every permit above and beyond the regular permit price in Otsego County. So if you look at the permit prices in Antrim, Charlevoix, and Emmett counties, the prices in Otsego County are $15 more.
Does that make up the difference?
It does make up the difference, yes.
Go ahead.
So you've been making up that difference since 2013 though, right?
What I can tell, it's gone back to 2013. If it goes further than that, I just don't have record of it, but
Understood,
yes.
but the additional surcharge has covered that
It has.
shortage
Yes.
annually.
Henry, do you want to share anything here? And I'd ask you to use your microphone, please.
I'm not on the budget finance committee. That's probably done annually. And I don't have sure beyond that to make up that difference with the president that has permit taken out.
Well, here's my concern. The health department makes an ask of each of our four counties. And that's based on a formula that they use to be equitable for the population in each of the four counties. If Otsego says, well, we're not going to pay our local appropriation in full, where do we wind up if all four counties say, well, we're not going to pay it either? Where we wind up is those grant dollars, those matching funds that our local appropriations are used for go down. There's less availability for funding. And Dan or Shannon, stop me if I'm wrong. But that's where the majority of our local appropriations go, is to match grants that come into the health department. So in effect, we have less ability to seek grants. And again, if all four of our counties say, well, we're just not going to pay our local appropriations, I don't know any county in northern Michigan here that has an overabundance of funding. We all try and be fiscally responsible here. So, how do we address this going forward? Ms. Lieberman had a great question there. How do we address this going forward? How do we say to Otsego, here's the request. This is why we've made that request. And going back for, it looks like 11 years now, one of those years, Otsego paid in full, but for the remainder, they have. And I'm not picking on you, Henry. I want you to understand that. I want to understand what's the best way to go forward.
I don't know what the budget finance committee has done to arrive at that. And I can say this, and I don't know, like Charlotte, your health, not the health, the health department here works on 1/2 mil funding, the same amount of money that Eagle County does on the full. The interesting thing, Eagle County has worked always for the tourists. Tourists is important in all of us. But with the lake, you have Lake Michigan, you have Lake Charles, high-end property. Do you still have St. Mary's cement in the area?
Yes,
That's a huge property tax value.
sure.
Otsego County lost lost a lot of manufacturing that did have. And you cannot replace that with services in the effect of the same value. And even Antrim has better. And Torch Lake, you have, unfortunately, we've done more to discourage manufacturing. Perhaps that's part of the result. I don't.
I have a question.
Go ahead, Chris.
So a couple of things. Many moons ago, when Linda Yarrow was in charge, or when Jerry Chase was in charge, and it would have probably been prior to 2013, there was a couple of issues that we ran through during the recession, where we actually reset some of the collection costs for some of the other counties, including Otsego and Antrim, where we lowered that, and then we tried to offset that if we could afford it through Emmett and Charlevoix and things that were going on at the time. And then it got back to normal, or it got back to balance, or whatever that was. To Henry's point, to me, it sounds like they've decided that in order to make up whatever it is, they're going to assess the people that are actually utilizing the services, as opposed to putting it across everybody. Now, as long as there's a stopgap in place, that's Otsego's prerogative. The real question that I would ask is, at the $15 surcharge that's being charged, are you ever exceeding the $7,000 that's short?
No, we recalculate it every year to be
Understood.
sure.
But do you stop? I mean, but you don't stop collecting the surcharge. Let's say they have a boon in building or whatever that is, and come October, they've made up the $7,000 worth of permit fees. Do you say, all right, that's it, we're not charging that extra $15 after October?
We've never been in that position, but yeah,
Right. Well, I'm just
that would be
asking. I
smart.
mean, you said that
Yeah.
makes up to $7,000. I mean, there's a fine line here between makes up to $7,000 or actually throws an extra 2,800 in the kitty. I mean, that's all I'm trying to figure out. I'm not coming at anybody here. I'm just trying to. I mean, it's a different taxation process where they're trying to make a user fee. The only security I think that any of the other counties would want is that there's some kind of a stopgap solution in place, that in the event that shortage hits, that Otsego would be willing to make up the difference. That would be my only suggestion, Scott, at that point.
Mr. Van Alstyne.
To me, it sounds like we're, and they're double taxing their people. They're setting money aside, the local appropriation, they're not paying all of it, and then they're telling their people that are using the services
they got to pay extra for it. To me, that's basically taxing them twice. I don't understand. We're talking about $8,000. It's a mere drop in the bucket for any of the county's budgets to pay what's being asked of them. I don't understand why we have to go through this. It cost the health department a lot of time to go through and recalculate everything. It's a huge expense on the health department for $8,000. It just doesn't make any sense to me.
Chair, I fully agree with Commissioner Van Alstine on that. The administrative costs and everything you have to figure into it also. You know, this is like, this doesn't just happen automatically. It takes time and effort, people and resources. And those, I don't think those are figured into that cost of that 7,000. So it is costing all of us. And as you pointed out, Chair, you know, the appropriations affect all of us. And we're in a cooperative, essentially. This is a cooperative, which means we cooperate. We work with each other, not against each other. But seems like that's not been the philosophy the last few years. There's been a lot of infighting, bickering, and personal stands made on personal ideologies that do not have anything to do with working in a cooperative. I don't understand how our counties can be working together and have this joint health department and not pay your damn bills. We all have to. Sounds like a deadbeat dad situation to me. You know, and I've had some familiarity with that stuff growing up. So it's not good. We need to be responsible. And what are the penalties for not paying your bills? We face them in our personal lives. What's the penalty for not paying bills for years and years and years? I don't get it.
Mr. Mason, go ahead.
If you're not aware of the drama of the last few years of this health department, from a general public standpoint, I don't know what to say about that.
Chair. Ma'am.
I have a comment. We know that it was $255,000 since we've been tracking it, that it hasn't been paid. We say it's being made up, but here's my question to you, Shannon. When you pay the permit, do you pull out that extra fund and separate and put it towards appropriations, or is it considered permits?
It comes in as a license and permit fee, so our fee and collections. But the fees and collections money is not like our grant money where there are very specific things we can use it for. So we still have the flexibility to use it the same way that we would for local appropriations.
But that extra money for Otsego is not put into appropriations when they pay their permits, so it's really deceiving.
It's kept separate because that's not coming directly from Otsego County, so we account for it with the license and permits.
Yeah, I would like you, if we could, to contact Otsego. I think it's just a standard procedure that they're so used to doing that nobody even knows why. I would like you to contact them and ask them. They may not even be aware of it.
I'll be happy to reach out. We did send the letters for this year with the annual request, so they are all at the county levels right now, with the county administrator and the finance director of each county, hopefully being prepared with the budget process.
Yeah, because that's what we're working on right now, and it would be very nice if it was explained to them so they're aware of it. Because right now we have no response. We don't even know why that is the issue, and it seems like, I think it was the last 4 years, it's the same amount that they haven't paid. But there was that one year in 2021 that it was paid, which is very interesting because that was the year that everybody was hurting. And I can understand if a county said, you know, we don't have money this year, we can't afford it. But it seems like it's been going on for a very long time, and it's probably just a standard procedure that people aren't aware of.
Mr. Van Alstine.
I have an idea that might help with that. What if we were to have the health director the finance director sat down with the board chair and the administrator to find out why they're not paying their full appropriation. We're guessing at a whole lot of variables. And let's get the heads of, per se, the heads of state together and find out why they're not. Then we would know. And if there's a true good reason that they're not, then we need to look at that and maybe we need to evaluate appropriations and all of that. But until we know the reasoning behind them not paying their full appropriation, I don't know. I don't like that where they're the only ones that aren't paying it, but maybe there's a reason behind it. And Henry said that it's done with the finance and the finance committee. So maybe that's what we need to do and find out what's going on with that.
Mr. Chair.
I agree. You want to make a motion?
Turnbull, go ahead.
So I disagree with some of that. I think sitting down, close the door with just the administrator and the chairman would be ill-advised. I would recommend it being more like Dan came and spoke to the full board. I think it was 2 weeks ago or 3 weeks ago, last month at some point. I think that's the point where it should be brought up because this is something that impacts the citizens, as you guys were mentioning, specifically with the added surcharge. So rather than meet, behind closed doors and, trying to work something out, and let's bring it out into the open and, Opens Meeting Act, so to speak, and, have it discussed. Hey, this past year, we asked for this amount, you gave us this much. Can you talk to us why? Because the impact that it's going to have is on the people. So that would be my recommendation at the next time that we sit down and we talk with the full board of our county board, Dan, to bring that up. And that would be my recommendation, at least.
Chairman Hankins.
Sir.
I'll be attending the Budget Finance Committee meeting Friday. We'll have a meeting there and we can discuss it between us then. As a member of the public, I can speak to that issue.
Well, I appreciate that. And I appreciate that you'll be bringing it before them. And I don't know if this is a surprise to yourself and Mr. Turnbull or not, but
No, I'm aware of it.
okay. Well, I like Jonathan's point that, let's have transparency in government. And Dan's well-versed in addressing county boards. He does it every year. I think with Shannon there as an assistant to speak to the specifics on the financial thing, I think that's a great idea.
I just have one comment about that. Would it be better to go to the budget and finance
Yes,
committee
yes.
versus the full board? Because it seems like that's a very specific budget and finance
Yes.
discussion.
Is your budget and finance committee, is that a public meeting?
Yes, it is.
Okay.
Right. So I guess, I don't know, I can get with Matt Barassi, the county administrator, and we can talk about, getting on that agenda and having that discussion at that.
I think
committee meeting.
that's,
So
is that a consensus for the board that we'd like Dan to address them?
Yeah.
Is that good? Mr. Mapes, you have something there? No?
I'm just curious, our budget's coming up for review here in the next couple of weeks. And we look at all the line items and so forth, what's requested, what's appropriated for those monies. Doesn't that happen amongst the
Yes,
full board of
yes.
commissioners at Otsego?
It's coming, no, it comes for the budget and finance here in September and October.
But you don't see the budget that you vote on it?
Well, certainly we do, but I didn't say I didn't see it.
It just seems to me that the whole board should be involved in this, not just,
Well, it comes to the full board in discussion.
I think what Mr. Mapes is talking about is whether or not Dan should address your budget and finance committee or whether you should address your full board.
I think either way, probably, they're
Maybe-
both in the record.
I
Maybe
mean,
both.
If you look at it, the people voting on it will move it to the full board is budget and finance. So that one would be good and specific, but addressing the full board would kind of pull in, I mean, individuals that aren't sitting on the Budget and Finance Committee meeting. Myself, I mean, there's, I think, 5 of us that don't sit on the Budget and Finance. So we'd be able to hearing the information given and also hearing information from our constituents. It would, beeping noises.
No.
But it would also, we'd be able to put pressure on the Budget and Finance people who will be making the decision. So, you know, half, 6 one way, half dozen the other, I suppose. But both would be good.
Okay,
Real-
Mr. Christensen.
Yeah, real quick, just as a veteran of the county politics, to Mr. Turnbull's point, maybe you let the finance committee make its recommendation, and depending on the recommendation, you go to the full board and they either explain thank you for the recommendation to pay it in full, or, you know, if the recommendation is to short the bill, then go there with the explanation of, all right, listen, this has been going on for a while. I mean, maybe Mr. Mason will be able to get the full appropriation out of his committee on Friday, but you still show up at the next meeting and either thank them for the full appropriation or ask them why it's been shorted again. That way you address the full board to Mr. Turnbull's point. That would
Absolutely.
be my recommendation.
Thank you.
Yeah, Dan, everybody likes meetings.
Of course. He wants to go. Scott wants to
No, Scott does not want to go.
go.
I will.
I've
if
been
you-
wanting to ride in a police car, you know, but
Like it'd be your first time.
no comment.
Okay. All right. Good. Well, I think we have marching orders for Dan. Back
Budget-
to you, Shannon. We took a
budget
little rabbit
question.
trail.
Any other budget questions? I'd be
Thank
happy to answer.
I'll make a motion that we approve the 2025 budget.
I'll second.
It's been moved and seconded.
Nice job with all the work involved.
There
in
is,
that.
there is,
Thank you.
Terry, on a side note, there is a specific suggested motion on the last page of your packet,
Okay. I'm
which
getting
also
there.
includes a dollar
you go.
figure in there.
The motion I made is I moved to the fiscal year 2025 initial budget in the amount of $37,955.
No.
$955,859 be accepted and approved by the Board of Health.
I second.
Okay. Any further discussion? It's an awful lot of money.
I'm going to ask the question. I'm really, you know, not, but I'm going to probably regret saying this out loud, but so the line items for the dental portion of this budget, right? So this entire Board of Health is about to approve a $37 million budget, but our focus has been on primarily the health department side of it, not the dental clinic side of it.
It's in here.
No, it's all
It's-
combined.
No, I understand, but it's also supposed to all be separate. That's why I'm trying to
is.
clarify. I understand, but okay. I mean, I understand what you're saying, but
I asked that question in the committee. It's a
Okay.
million over on the health department, a million over in the dental. And dental is finally making money, which is wonderful.
Well, it's been making money because of the increase in
Medicaid.
reimbursement through
Yes.
Medicaid. So it's been making money on the dental side.
okay.
It's broken out on the.
Right. So you approved the appropriations for the dental through here as
Right.
well.
It's all in here. Yes.
Okay. Because at one point they were two separate entities.
Well, they are still broken out in our
We-
budget.
We account for them
Understood.
separately in your sheet. You'll see that
But
colorful.
there's no board other than this board that oversees the dental health board.
We own the dental clinics north
Okay.
company.
So my recollection is the old way then.
Well,
There
we don't
were
do-
two.
Dental Clinics North, the nonprofit,
Mhm.
that's basically that staffs our dental clinics that we own, that the health department owns. Dental Clinics North, the nonprofit, staffs those with the dentists and the hygienists and the front office
Did you
staff.
just subcontract with that?
Correct. It's
Correct.
more or less like a contract item, a
Okay.
fee that gets, you know, basically goes back and forth. But the Dental Clinics North nonprofit, they do their own budget.
Okay.
Right.
And who oversees that?
And there's no local appropriations, no local dollars, no
I
county
know,
dollars.
I'm told
go.
that every year, and
It's
every
true.
every year I feel like I have to ask the question because it all comes mired together in one great big packet.
Yeah.
No, I think we fixed
Yeah.
that last year.
Yeah, and there is a board that
For the-
oversees that for Dental Clinics North, the nonprofit. It's a nonprofit board, and actually I'm on it. Linda Yarrow is the president.
Okay,
So, and she is a wealth of knowledge. So
I'm well aware.
regarding that, so
I've had many meetings with Linda Yarrow. Ironically, over budget.
right.
So, okay.
All right, we had a motion and a second. Is there any further discussion? Can we have a roll call, please, Mel?
Commissioner Christensen,
See how that goes? See, right? Yes, I'll vote yes. Twist my arm.
Commissioner Van Alstine,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Lebanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Mason,
Yes.
Commissioner Henkins,
Yes.
Commissioner Turnbull.
Yes.
Motion passed.
All right. Program and Evaluation Committee. Do we have anything
No.
to present from that committee?
There's nothing.
All right,
Yeah.
thank you. Moving on then to unfinished business, we have none. Moving to new business, we have none. That moves us again, ladies and gentlemen, to public comment. Again, you'll have 3 minutes to address the board. We would ask you to step to the podium, state your name and where you reside. I'll give you the friendly 30-second warning. Would anyone like to address the Board of Health? Seeing and hearing none, we will move on from public comment to commissioners' comments. Mr. Van Alstine,
Good to go.
Ms. Levanway,
Nothing.
Mr. Mason,
Nothing.
Mr. Turnbull,
Nothing. Thank you.
Mr. Mapes.
Nothing, thank you.
We're just over an hour here.
I'm done.
Okay.
Getting better.
Mr. Aaron's.
All set.
I was gonna say, don't you dare. Mr. Christensen.
I'm all set. Thank you.
All right, I have nothing. I will take a motion to adjourn.
I'll make that motion.
Second.
Moving to second and all in favor, say aye. Aye. Any opposed? 103. Mel, can you write that down somewhere?
Getting better.